Have you ever wondered why coronary artery disease is one of the leading causes of death worldwide? To unravel this, let's first understand what it is. Coronary artery disease, often abbreviated as CAD, is a cardiovascular condition where the arteries supplying oxygen-rich blood to your heart muscle get narrowed or blocked. Imagine these arteries as your heart's very own highway network. Now, when this network gets congested due to traffic jams, in this case, plaque buildup, the supply of oxygen-rich blood to your heart is compromised. This plaque is a sticky cocktail of cholesterol, fat, calcium, and other substances. It's the villain of our story, initiating a process called atherosclerosis, causing the arteries to harden and narrow down. This disruption in blood flow can potentially starve your heart of the oxygen it needs to function properly. Understanding coronary artery disease starts with knowing what it is and how it impacts our heart's function. So, what causes coronary artery disease? At the heart of it all is a process called atherosclerosis. This is when a buildup of plaque, a substance made up of cholesterol, fat, calcium, and other substances, starts to cling to the inner walls of the coronary arteries. Over time, this buildup narrows the arteries, making it harder for the heart to get the oxygen-rich blood it needs to function properly. Now let's talk about risk factors. A number of things can increase your chances of developing coronary artery disease. These include smoking, high blood pressure, high cholesterol levels, diabetes, obesity, leading a sedentary lifestyle, and having a family history of heart disease. It's important to remember that having these risk factors doesn't mean you'll definitely develop coronary artery disease, but they do significantly increase the likelihood. These risk factors don't guarantee you'll get coronary artery disease, but they significantly increase the chances. How would you know if you might have coronary artery disease? The most common symptom is angina, a type of chest discomfort described as squeezing, pressure, heaviness, tightness, or pain in your chest. It's often mistaken for indigestion or heartburn. Angina is usually triggered by physical activity or emotional stress and can be relieved by rest. Other symptoms can be less noticeable. These may include shortness of breath, especially with physical activity, feeling of fatigue or extreme tiredness, nausea, sweating, or even dizziness. These symptoms often start as mild discomfort and gradually worsen over time. Another important thing to note is that symptoms can vary between men and women. Women are more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea, and extreme fatigue. It's crucial to pay attention to these signs and seek medical advice promptly. The earlier the diagnosis, the better the chances of managing the disease effectively and reducing the risk of serious complications. Diagnosis is the next step, but how do doctors diagnose coronary artery disease? Well, the process begins with a thorough examination of your medical history. Your doctor will ask about your symptoms, lifestyle habits, and if there's a family history of heart disease. Next comes the physical examination. Your doctor will listen to your heart to check for irregular rhythms. They'll also check for signs of heart disease elsewhere in your body. For example, they might look for swollen ankles or a faint pulse in your legs, which can indicate poor blood flow. Now let's talk about tests. Your doctor may order a series of diagnostic tests, such as an electrocardiogram or EKG, to measure the electrical activity of your heart. Other tests might include a stress test, where you'll exercise under medical supervision to see how your heart responds, or an angiogram, which uses dye and special X-rays to show the insides of your coronary arteries. Through these tests, doctors can accurately diagnose coronary artery disease and determine its severity. What happens if coronary artery disease goes untreated? Well, the complications can be severe and life-threatening. If coronary artery disease isn't managed properly, it can lead to a heart attack, also known as myocardial infarction. This happens when a coronary artery becomes completely blocked, preventing oxygen-rich blood from reaching the heart muscle. As a result, the heart muscle starts to die, causing chest pain and potentially cardiac arrest. In addition to this, irregular heartbeats or arrhythmias can develop. These may cause the heart to beat too fast, too slow, or irregularly, leading to a range of symptoms from fatigue and dizziness to sudden cardiac arrest. Heart failure is another serious complication. This condition means that your heart can't pump blood as well as it should, leading to fluid buildup in the lungs and swelling in the legs and abdomen. Lastly, sudden cardiac death can occur without any prior warning signs. These complications underscore the importance of early diagnosis and treatment. Once diagnosed, what can be done to manage coronary artery disease? This is a question that many people ask. Unfortunately, there are several treatment strategies available. The goal is to alleviate symptoms, improve quality of life, and prevent complications. First off, lifestyle modifications play a crucial role in managing this condition. This includes quitting smoking, as tobacco use is one of the significant risk factors for coronary artery disease. Adopting a heart-healthy diet rich in fruits, vegetables, lean proteins, and whole grains can help lower cholesterol levels and manage body weight. Regular physical activity is also beneficial, as it can strengthen the heart muscles, lower blood pressure, and improve overall cardiovascular health. However, lifestyle changes alone may not be enough for everyone. That's where medications come into the picture. Depending on the individual's condition, doctors may prescribe medications to control blood pressure, cholesterol levels, and blood sugar. Antiplatelet drugs may also be used to prevent the formation of blood clots, which can block the coronary arteries and lead to heart attacks. In more severe cases, or when medications and lifestyle changes aren't enough, interventional procedures may be necessary. These could include angioplasty, where a balloon is used to widen the narrowed artery, or stent placement, where a small mesh tube is inserted to keep the artery open. In some situations, coronary artery bypass grafting, or KBG, may be performed. This is a type of surgery where a healthy artery or vein from another part of the body is used to bypass the blocked coronary artery, thereby improving blood flow to the heart. Remember, the goal of treatment is not just to manage the symptoms, but also to prevent complications, such as heart attacks and heart failure. Therefore, regular follow-ups with the doctor, along with adherence to the prescribed treatment plan, are crucial. The goal of treatment is to alleviate symptoms, improve quality of life, and prevent complications. And with the right treatment approach, individuals with coronary artery disease can lead active and fulfilling lives. The good news is, coronary artery disease can be prevented, but how? Well, prevention of this cardiovascular condition revolves around addressing the modifiable risk factors through lifestyle changes and medical interventions. Firstly, adopting a heart-healthy lifestyle is crucial. This includes a balanced diet, low in saturated fats and cholesterol. Consuming more fruits, vegetables, lean proteins, and whole grains can help keep your heart in good shape. Next, regular physical activity is key. Aim for at least 30 minutes of moderate intensity exercise, like brisk walking or cycling, most days of the week. Incorporating physical activity into your daily routine not only strengthens your heart, but also helps maintain a healthy weight. Another important factor in preventing coronary artery disease. Stress management too plays a role in heart health. Chronic stress can lead to behaviors and factors that increase heart disease risk. Find healthy ways to cope with stress, like yoga, meditation, or simply taking time out for a hobby you enjoy. And let's not forget about avoiding tobacco use. Smoking or using tobacco of any kind is one of the most significant risk factors for developing heart disease. Chemicals in tobacco can damage your heart and blood vessels, leading to narrowing of the arteries. In addition to these lifestyle modifications, routine medical checkups and screening tests are important for early detection and management of risk factors for coronary artery disease. Regular monitoring of your blood pressure, cholesterol levels, and blood sugar can help identify issues early and allow for prompt intervention. Moreover, adherence to prescribed treatment regimens, if you have risk factors, is essential. This may include medications to control high blood pressure or high cholesterol. So there you have it. While coronary artery disease might sound daunting, remember, prevention is within your power. Prevention is the best cure. By adopting a heart-healthy lifestyle and being proactive about health checkups, the risk of coronary artery disease can be significantly reduced.